So our day of celebration has arrived. It's time to go ahead and give Mr. Bothe his final dentures. He has been he has been wearing his duplicate of his approved provisional denture that was relined with hydrocast, and we showed you guys how to do that. And the luxury of that is that most patients don't require a lot of attention or even adjustment of sore spots while you're fabricating and finalizing the complete denture. We had to see Mr. Bothe a couple times, but most of the time patients do real well. That duplicate denture will also serve as the patient's spare denture. If for some reason a tooth breaks, or you want to reline that denture, or it needs some sort of maintenance item done, we just have the patients pull their duplicate out of the freezer, which is where we have them store it, and they can pop it right in their mouth. The luxury for us then becomes that we can take as long as we need to repair or reline. The lab can also take as long as they want to finalize and get a really, really nice final denture. We decided that in Mr. Bothe's lower denture we would place a permanent soft liner, and then we've got a custom characterized upper. Prior to his arrival for the day of insertion, we have made remount models, which we've showed you on the video how to do, and we'd hope that you do that, because when we insert the final denture, we're going to do a remount and a grind-in procedure. Now, this is one of the steps that very few people do. It's a little bit of time consuming and it requires a little bit of lab work. But I have to be honest with you, ladies and gentlemen, this is the step that gets you over the goal line. If you leave this step out, if you don't remount and you don't grind it in, you will not have compensated for any of the distortion that goes on during the final denture fabrication process. And with that much acrylic around porcelain teeth or plastic teeth, you are going to get a certain amount of change. The only place to fix that is in the patient's mouth. So prior to us coming and putting this in, we made our remount models. We preserved the Facebook recording that we had made at our finalization process so that we could actually go ahead and tack that upper model down. And all we really need to do now is insert the final denture, take a bite record, run back in the lab, tack that lower down, and grind it in. Now, the bite record of my choice will be a Delar wax record using bimanual manipulation, just like I showed you in the finalization process. You can use a central bearing point if you'd like to make this record, and a lot of people do, and I've showed you how to do that. And then you can use the 4-stop technique. I've showed you how to do that too. And so I'll use the Delar record with bimanual manipulation, and I'll probably put 4 drops on there because I feel like that's the most stable when we get it in the lab. Once it's been ground in, then we can give it to Mr. Bothe, give him some specific instructions on how to keep things clean, how to maintain the soft liner in the lower, and recall him in about 6 weeks. We should have taken care of all of our sore places and that sort of thing ahead of time, but anytime you give a patient a whole new denture, you should expect the possibility of 1 or 2 adjustments in there. More than that, I would be kind of suspect that maybe we missed it somehow with the record or the hydrocast or something like that. Also, before Mr. Bothe comes, I can go ahead and make our Delar record on the upper denture. So we have our remount models made before he gets here. We have half of our bite record done before he gets here. And this Delar now is nice and rigid and stable. We haven't done anything with the lower denture because we're going to do that in his mouth. Okay, what we've got here is his final denture, this custom characterized, really, really pretty final dentures with soft liners in the lower. We've got porcelain teeth in the posterior, 33-degree true bite teeth. In the anterior, we have creopearl composite teeth. On the lower, we've got porcelain, 20-degree lower porcelain true bite teeth with creopearl lower anteriors that match the mold that we selected. And then we've got a permanent soft liner in the lower. Now, one of the things I do with my soft liners is I put hard acrylic over the retromolar pad. I like to have that brick-like stop on the back end of a denture so that we won't get any occlusal change in the posterior aspect of this denture. As you know, the retromolar pad serves as a nice firm stop because that's where the cortical bone begins and the alveolar process ends. So it's non-resorbable bone back there. So I feel like if I have a nice firm stop, then we won't get any occlusal change long term. The other thing it does for you is it gives you a thickness of acrylic back here so that if you have to adjust, you're not going to be real thin. And we happen to have plenty of room in Mr. Bothy's mouth, but some people you won't have much room to be able to put acrylic and soft liner. So I would encourage you to put an island of acrylic over the retromolar pads on the lower. And this is a little different than probably what you've been taught by some of the other denture guys, but I have found it to work much better for me. Okay, Mr. Bothy. The way we do this with a new denture is we go ahead and put it in. And then without having the patient close on anything other than a couple of cotton rolls. And I'll place a cotton roll over the posterior teeth of the lower. Gently close on those cotton rolls for me, Mr. Bothy. Open just a little bit. Now close again. There we go. And typically what we'll do is we'll let that patient close on the cotton rolls for about 10 to 15 minutes. What that does is it allows any change from the duplicate denture to the final denture in the soft tissue, lets the patient kind of feel it without the teeth coming together, because that could alter the whole way the jaw relation is going to be. And so sometimes Kathy will take that brand new denture, she'll take it in the room, put it in the patient's mouth, have them close on some cotton rolls before I ever even come in there. And so this is a deprogramming procedure, but it also helps to settle everything in place so that when we take our bite record, we get a real accurate bite record of a denture that's fully seated onto the soft tissue. Now, Mr. Bothy's been on his cotton rolls for about 10 minutes, and now I can put my hands on his mandible and just kind of feel and see if I've got a loaded condyle. The nice thing about denture patients, I feel like, that many times they're very easily manipulated into centric relation. And after they've been on the cotton rolls and things have settled in, it's really very easy. I want you to take a look at my hand position now. This is the classic bimanual manipulation. And I'm forming the C with my thumb and fingers. My 3 fingers are on the inferior border of his mandible, and my little finger is just a little bit behind the angle of the mandible. We went over this once before in this process early when we were talking about taking jaw relation records, but I just wanted to review it. This should be second nature to you when you put your hands on a patient like this. Always forming that C, and then the motion, as we talked about, is the old-timey can opener. The other thing is, if you'll notice, my forearm is against Mr. Bothy's head, and it's bracing his head against my chest. Excuse me. And so that he can't really move away from me. I've got a nice, actually I've got him in a step over toe hold, if you want to know the truth. You ain't getting away from me, boy. This makes it a little bit easier because now the only movable part is the mandible. Okay? So what I'm going to do is take these little cotton rolls out, and Kathy's going to keep her finger in your mouth, and she's going to keep him apart. We don't really have to worry about the bite record fitting and changing it. We made it on the denture. You know, with a patient with teeth, you have to make it in their mouth, and you got to make sure it fits, and you got to chill it, and you got to go back. We did all that before Mr. Bothy got here, and I've got a beautiful little bite record. So that all I have to do now is warm the underneath surface of the wax. Just like you learned in all the other Dawson courses, you want to just soak these areas with heat. You don't want to get it so hot that it drips. But as you can see, it changes color, and I'm just going to go side to side, just imparting some heat into that wax. The nice thing about having already had this made is the center of the D-lar is still very rigid and will provide for us a nice rigid bite recording medium. And I'm only warming where the lower teeth are going to go. Okay? Once I've got a lot of heat built up in that wax, I'm going to carry it over to Mr. Bothy's mouth. We'll just snap it onto that upper denture. Making sure the lower denture is firmly seated. Now I can do what would be considered a modified hand position. Okay? I can put my thumbs now right on the canines of the lower denture. Push it into place and then slide your hand down to the buccal surface of the canines. Now if you'll notice, I'm still forming the C, and let's let your jaw just relax, Mr. Bothy. There you go. Excellent. And then I'm just going to hinge him straight up. Come on up for me now. Come on up. That's perfect. I can then kind of let go. Now load his mandible, and let's squeeze up. Okay, now let's take a look. I'm going to take a quick look on either side, make sure I've got some little indentations. Okay, now let's open. That denture's going to stick there a little bit. That's okay. Now let's close again. And I'm going to see if he can find it almost on his own. Yeah. This is an open mouth record, and in Mr. Bothy's mouth I can see tooth, wax, tooth. Tooth, wax, tooth. Okay? Open for me now. Okay? And then I'm going to get you to put that back in. Now, as you've seen before in a lot of the different classes that I've taught, whether it's a partial class or a denture class or prosthetic success, what I like to do is the 4 drops. One in the second molars, one in the canines, one in the second molars, one in the canines. The reason I like that is when I get this back in the lab, when I put it together on the articulator, it gives me a much, I think, more stable bite record in the lab. So now, the little pieces of excess D-lar wax that we trimmed off, I'll just drop that. Now that wax is dead soft when it hits the existing D-lar. And I just build up 4 little pools. Now, we're going to let that cool just a little bit, or you can drop it and temper it in a little warm water and cool it a little bit faster. Now we're going to jump back over to Mr. Bothy. The nice thing about D-lar wax is that it will hold the heat a really long time. And so I have plenty of working time. We'll pop that right back in Mr. Bothy's mouth. I'll make sure that that denture is firmly in position. Let's let your jaw just relax. He's such a good patient. He knows the parts and the way to do this without me hardly having to do anything. Let's gently close up. Come on up, come on up, come on up. Now as he gets into the wax and the denture is seated, I'll check my hand position. Let's gently, gently let me just push you up into the wax now. Perfect. Perfect. Okay. Now I'm going to let you open for me. And I'll probably pull that lower denture down. Let's see. Here we go. So I've got my lower denture, and there's my little 4 dots. Where the dots are, the teeth in between are not in the wax. Now I'm going to drop this in a little cool water before I pull this off because I don't want to distort those 4 dots. Now as I bring this back over, once again I think you can see these little 4 little areas, and that lower denture now is going to fit in there rock solid. So when we go to put our remount model in here and we put this on the upper denture, now we have only 4 little dots and a really nice rigid record to do that with. So we're going to take this record and Mr. Bothy's final dentures, we're going to run back in the lab and I'll demonstrate to you how to remount it right quick and grind it in. We've been in the operatory with Mr. Bothy. We've put his final dentures in his mouth, let him sit there with some cotton rolls for a few minutes, and we've taken a centric bite record. We've used the little 4 drop techniques. One of the things I want to tell you about a bite record is always keep it floating in a little water. If you lay it on the countertop, it's just going to flatten it out and it's going to not allow it to stay dimensionally stable. Write the patient's name on the cup with a little Sharpie marker, drop in a little cold water, and just let it sit in the pan. Or you can store it in the refrigerator, and it'll keep that wax dimensionally stable for a really, really long period of time. So we've got his bite record. We know it fits on his upper denture real well because we made it on the upper denture. And so it snaps right on. Here's our lower model with the base poured on it. And so this is our remount model. Now Mr. Bothy's in there reading a magazine, so we need to get with it. We need to go ahead and get these on an articulator. We'll hold it right into the bite record, and you can see how stable that is in my hand. If I take my finger off of it, it's not going to fall off. If I turn it over and take my finger off, it will. So we're going to use our little coat hanger technique. I can then click it back on my articulator. We want to check and see about how much space we've got. So we don't need a ton of mounting stone, Kathy. Thank you. We put a little bit on the base of the model. And frankly, I always like to put just a little bit on this mounting plate, get it up into the undercuts, because I have had them come off the plate where we didn't get it up in there. Let's check it and see if we've got it engaged. Oh yeah, okay. Got plenty of stone on there. I'm just going to take some of this excess off. Trying to keep my articulator clean while I'm doing it. Now, the key here is don't dink with it. Just let it set. Give it about 10 or 15 minutes. Run check your hygiene patients, get your next patient started, whatever you got to do. And you'll be able to come back, grind that into some nice solid lingualized occlusion, and then we'll take it to Mr. Bothy's mouth and let him wear them. We've let the mounting stones set. We're going to take our bite record out now. And if you're the dental assistant in this practice, I'd recommend that you go ahead and get the models, the dentures, sit them at a place where there's a handpiece and some articulating ribbon. So the doctors can just come flying in there, pick up the ribbon, tap, 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 and when you really think you're good and you did everything just right, you'll see that you've only got one contact. And that's the error in the process. We can compensate for that error just by doing a little light grind in. I use a lab handpiece and a green stone, put on some loops, and I want to do all of my grind in on the lower if possible. All of my grind in on the lower if possible. There will be an occasion where you're going to have to recontour the lingual cusp of an upper second molar to bring it back into the central groove. But that should be a rare occurrence. And there may be some teeth you cannot get into occlusion because you'd have to mutilate all the other teeth to get them down. But that's usually one tooth every now and again. So I'll fire up my handpiece. And all I'm going to do is shallow out those initial contacts, and using lingualized occlusion, which we talked about, and it's in your manual, we want to idealize the lingualized occlusion. What you're looking for is a string of dots. And if you look at the lingual cusps of the upper molars, you want that little string of dots running down the lingual cusp. If you look at the central groove, you want a little string of dots. The other thing you'll notice is I checked it first with blue, I made my changes, then I checked it with red. Keep switching off the colors, and that way you can see the effect that you've made. Now, as I look at this, Mr. Bothy's he's a class 3 type patient. He's a little bit end to end, and I see that he's hitting a little heavy on the anterior. I do not want that. I don't want the anterior teeth touching before anything else. So I'm going to lightly reshape the lower anteriors. Now I'll switch back to my blue. And we'll take a look. We're really working down the lingual cusp. Everything's kind of dropped into position. And frankly, I wouldn't do much more than that. That's the benefit of lingualized occlusion, is you have that grinding stock, if you will, in the occlusal surface of those 20-degree lower teeth. We'll repolish where I adjusted on some of these teeth, and then we'll clean them up real good, scrub them with a little bit of disinfectant, wash them off, and we'll go into the operatory and give those back to Mr. Bothy. Now we're ready to let Mr. Bothy actually have his final teeth. We'll put these in, and what you're going to notice is, I'm not going to check them in his mouth. We took the bite records. We have a lot of confidence in the lab procedures that we do. Close for me now. Here's what I want you to do for me, Mr. Bothy. Count from 1 to 10 for me.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
55.
55.
Now I want you to look at Stephanie over there and give everybody a big smile. There you go.
66.
66. I told you we'd know our numbers when we got through. And so the whole process of the phonetics, one of the proudest things is to hear you in the pulpit read from the scripture.
Yeah.
My ears perk up, and I'm listening for the S's and that sort of thing, so that when you were first Satan, I'm listening for the for the S, and sins and everything. But that for me is a very proud thing, and to see you smile.
Oh, I didn't know that.
Oh yeah, to see you smile is a big deal. So when we're all done, and we feel good about the bite, and the patient's phonetics is good, and they're happy with the aesthetics, you know, the approved provisional process allowed us to do all of that. So today is not making excuses or tap dancing around the bottom of the chair saying, well, you'll get used to it, you know. No, it's all, everybody's happy at the end. And even though this is a fairly costly procedure for a patient, more than they'd ever thought they'd ever spend on a denture, we haven't made them a denture. We've done a full mouth reconstruction. So one of the things we like to do for them is we get them one of these big old denture brushes, and we teach them how to clean the denture. We teach them about the soft liner. One of the things we like for patients to do with a soft liner is about once every 2 weeks, so maybe twice a month, I want you to soak that lower denture in about a 50-50 mix of white vinegar and water.
Okay.
Yeah. Soft liners have a tendency to pick up oral fluids, and you can even get little funguses and stuff on it. So other than that, we recommend that they scrub it with a brush, and inside the denture where it meets your gum, and scrub the teeth like you would if you were brushing your teeth. We tell our patients to wear their dentures 24 hours a day. 24 hours and 55 minutes, or 23 hours and 55 minutes a day. Take it out 5 minutes to clean it, you know. Because this denture has been made with the teeth, with the gums and the tissue in its passive state. We're not compressing the tissue. And that was the beauty of the hydrocast. And so when we gain good health of the soft tissues, the denture is going to keep it healthy for us. And so patients really like to be able to wear their teeth when they sleep. They like to be able to never really have to take them out. And they should be so comfortable that they really don't know they're in there. The other thing that we recommend for patients to use is this denture cleanser. It's a really old product. It's called Smile Again. This is a very interesting denture soaking product in that when you mix it up, it lasts for a week. And what you do is you put your dentures down in it. You let them sit for about 15 minutes, and then you clean them. And basically what it does is it takes the stain and dissolves any calcified, like calculus or tartar that builds up on a denture. And so we keep this in the office. We also have kids that will use this for their ortho retainers. We put this all in a nice pretty bag. We also give them their duplicate dentures in a little denture cup, and we tell them to store their duplicate denture in the denture cup in the freezer and write on the denture cup what it is. So if somebody cleans the freezer out, they won't throw your teeth away. We'll set Mr. Bothy up for a 6-week check, but if he needs me between now and then, all he's got to do is call. All righty?
All right.
Sounds
Yeah.
great.
Yeah.